This is Pick Your Poison. I'm Dr. JP, ER doctor, toxicologist, and unapologetic lover of all things poison. Want to know what medical myths are associated with absinthe? What famous figure carried a hollowed-out cane filled with alcohol? And what plant was used in an expression by Shakespeare to indicate the bitter truth? Stay right here to find out. This is an interactive story. Will our patient live or die? It's up to you and the choices you make. So grab your stethoscope. Today's episode starts in front of an unmarked door. You check your phone, confirming it's the address your friend sent. This has to be it. You push the door open. You're immediately wrapped in low, drifting music and quiet conversation. The lighting is dim, highlighting velvet and dark wood. It feels like stepping out of time and back into Belle Époque Paris. At the far end of the bar, you spot your friend. She smiles, stands, and pulls you into a quick hug. You take the stool beside her. It's an absinthe bar. The bartender begins the elaborate ritual of making the drink. He puts a small glass down in front of each of you, and then with a soft clink, puts a silver slotted spoon on top of the glass. On this spoon, he places a sugar cube and pours several ounces of clear green absinthe into the glass beneath. He then lights the cube on fire and slowly drips cold water over the entire mixture until it turns a cloudy opalescent green. You take a sip. It's strong, bitter at first, and has a lingering medicinal taste. Your friend says she's been wanting to come for months. She says, I know the owner, we dated briefly but remained friends, and he promised to come and say hi. You feel your shoulders relaxing as some of the tension from the long day fades in the calm atmosphere. Then, a door behind the bar slams open. The sound cuts through the quiet. A tall man strides through. Your friend smiles and starts to say hi. Clearly, it's the owner, though he isn't doing much for the ambiance. He shouts at the bartender for a drink. The smile disappears from your friend's face. The owner has a knife in his hand and is staring directly at her. He's swearing at the top of his lungs and carrying on a conversation with someone who clearly isn't there. Then he shouts, "It was you," and rushes toward your friend with a knife. For a brief second, you wonder what kind of relationship they'd had. Before your instincts kick in, you kick over the bar stool next to you directly in his path. He trips and falls, fortunately not on the knife. It skitters across the floor. You grab your friend's arm to get out of this bar as fast as possible. The man is lying on the ground looking confused as to how he got there. He's muttering to himself about being followed and recorded. Something about Hollywood controlling his actions with neural implants. You hesitate for a second. Does he have mental illness, you ask? Well, he was a little unusual, she says, but not that I know of. Did he ever try to hurt you? No, she says, he was never violent. Question number 1. This is most likely A, a personality disorder, B, a panic attack, C, psychosis, or D, PTSD? The answer, this is probably C, psychosis. He seems to be talking to someone that's not there and is obviously very paranoid. Neither of those is a hallmark of personality disorders or panic attacks. Occasionally, people with PTSD can have psychosis, but it's rare, and this doesn't look like a flashback. Around you, the bar is emptying as people rush to leave. Call 911, you say to your friend, though it's unclear if this is a matter for the police or an ambulance. The bartender says the owner's behavior has been increasingly erratic and violent for the past few months. He said he'd been considering a new job, but had never anticipated his boss would try to kill someone. You and your friend wait outside. Both police and medics arrive. After a lot of shouting from inside and crashing noises, the medics roll out with the owner handcuffed to the stretcher, accompanied by the police. He's spitting at them and fighting against the handcuffs. This is fiction, so of course, you're the doctor. On arrival to the emergency department, the patient remains extremely agitated. You call for security assistance and 6 large guards show up. Just transferring him from the EMS stretcher to the hospital one is going to be difficult. He's spitting and trying to bite anyone who gets close. Question number 2. What is the first step? A, let him refuse care and leave. B, intubation. C, sedation. The answer is C, sedation. Why are we doing this? He's clearly a danger to other people. He just tried to stab your friend, and he therefore lost the right to refuse care. We need to do a medical evaluation to see if this is a medical issue, and if not, he needs psychiatric care. Security manages to slide him across, and unfortunately, you have to apply 4-point restraints, tying his arms and legs to the bed. The physical restraints are a temporizing measure. I would definitely give him some medicine for sedation so he doesn't hurt himself fighting against them. There are a lot of options. We could discuss it at great length. Many of the options include benzodiazepines or antipsychotics, with risks and benefits to both. In this case, I would probably order an antipsychotic, given that he appears just that, psychotic. The nurse gives him an intramuscular injection in the arm with the help of 2 security guards to hold him down. 20 minutes later, he's much calmer, and the nurses can safely put in an IV and check his vital signs. His temperature is 98.6 Fahrenheit or 37 Celsius, heart rate 120 beats per minute, blood pressure 120/80, respiratory rate 18 with oxygen saturation 100% on room air. Your physical exam is very limited, but he is able to tell you the year and the month. He tells you he's 31 years old. He can't cooperate with the full neurological exam, but there's nothing obviously wrong. His heart and lungs are clear, his abdomen is soft and non-tender, and he is for sure moving all of his extremities with superhuman strength. In the meantime, your friend has tracked down his family through friends of friends, and the patient's mother arrives at the bedside. She says the patient has no prior past medical history. As far as she knows, he doesn't take any medicines and has definitely never had any prior psychiatric history. So what is happening to our patient? This could be a case of new-onset psychosis. Psychosis is when a person loses contact with reality. Essentially, they can't tell real from imaginary. Classically, they have auditory hallucinations. In medicine, we call this responding to internal stimuli, meaning they're talking to someone who isn't there. This could also be delirium from a medical cause. Say he had some sort of untreated infection like meningitis, he could become delirious. So how do you differentiate the two? That's question number 3. Which of the following is the most useful? A, the timeline, B, violent behavior, C, age, or D, history of insomnia? The answer is A, the timeline would be the most useful here. Patients can be violent in psychosis and delirium both. Insomnia isn't really relevant. Age doesn't necessarily distinguish between the two, though we do know that psychiatric illness like schizophrenia often begins in the 20s. The delirium happens over hours to days because it's due, again, to an acute medical problem. Psychosis happens more gradually, typically over months or years. He clearly wasn't psychotic when he was dating your friend, but the bartender noted a decline in his behavior over the past few months. I'd be very suspicious this is psychosis, but the real answer is we need a medical workup to exclude causes of delirium and psychosis caused by medical problems first. Essentially, our job in the emergency department is to rule out medical causes. If we can't, we admit the patients to the hospital for more workup. If we don't find anything concerning, then we talk to psychiatry about the possibility of new-onset psychosis. It can be pretty tough in the emergency department because we don't have a lot of time for this workup, but we also know that psychiatric causes are very common in otherwise healthy 20 or 30-year-olds. So what should we do? We start with the basics, labs to check for electrolyte disturbances and evidence of infection. I'd certainly get a chest x-ray and a urine specimen to look for pneumonia or a urinary tract infection. Some people might want a CT scan of his head. It's not unreasonable, though I'll tell you it's pretty low yield in these cases. An hour later, everything comes back stone cold normal. Labs, including his white blood cell count, as well as his electrolytes, including his sodium. The CT scan of his head is normal, as is his chest x-ray and urine. The nurse tells you your patient is agitated again and wants to know if you'll order another dose of sedatives. What now? In cases like this, we have to consider a spinal tap to make sure it isn't something like meningitis or encephalitis. This is always a really tough question because on the one hand, you want to do a thorough workup and exclude all medical causes, but on the other hand, doing a spinal tap on a psychotic person is nearly impossible, and it is definitely not without risks, so you have to do a serious analysis to weigh the risks against the benefits. Before we do a spinal tap in this patient, I'd consider toxicologic causes. There are a lot of things that can cause psychosis. What about a urine drug screen, did I hear you say? You can send one, but the results will have to be interpreted with a healthy dose of caution. Why? Because of the tremendous possibility of false positives and false negatives. First, if something is positive in the urine, we have to decide if it's really the cause of the psychosis. What if it's just an incidental finding, something he randomly took in an attempt to self-medicate, perhaps? Second, we've discussed that urine drug screens only screen for a handful of substances, so if the drug screen is negative, it by no means rules out toxicologic causes of the psychosis. You can ask his mom about drugs of abuse, though clearly she's not going to be the best source. You text your friend back, thanking her for her help and asking her to see if she can get any more history from the other friends in their circle. His mom says he doesn't smoke, drinks some, but not too much, and doesn't use any drugs. Your friend texts back, he drinks like crazy. I mean, he owns a bar and that's why I only went on a few dates with him. He also used a lot of cannabis. The first couple dates were fun, but after that it was clear he had serious substance use issues. What about other drugs? She says, I never saw him do anything else, but let me ask around. Let's talk for a few minutes about drugs that cause psychosis. What we see a lot of in the US these days is methamphetamine. It can cause severe psychosis where patients become suicidal and homicidal. Other sympathomimetics can certainly cause it as well, cocaine, etc. Cannabis is popular worldwide, and long-term cannabis use carries a risk of psychosis. A classic cause of agitated violent behavior in the emergency department is PCP. I'm sure you've seen a picture of someone strapped in restraints to a stretcher, high on PCP with superhuman strength, agitated and psychotic, and flips the stretcher over. I saw something online a few months ago saying that this was a myth. Clearly, the person who wrote that had never worked in an emergency department. Anyway, could this be meth, cocaine, or PCP? It's definitely possible, but he doesn't have a classic sympathomimetic toxidrome. He does have a rapid heart rate, but not a high blood pressure or sweaty skin. He is obviously hallucinating, as we said. What about hallucinogens? Definitely LSD or any other hallucinogens could be a culprit. We mentioned alcohol, since he owns a bar, and alcohol withdrawal can certainly cause hallucinations. Think of the classic pink elephant. Could this be alcohol withdrawal? It's a potentially life-threatening diagnosis, and knowing his history, we have to consider it. Patients do hallucinate, but we don't typically see this kind of wild agitation. He is tachycardic, which goes along with alcohol withdrawal, but again, his blood pressure should be elevated, which it wasn't. And on exam, we didn't see a tremor or tongue fasciculations, so I think withdrawal is less likely at this point, but if he's admitted to the hospital, they will have to monitor him closely in case he develops it. What about plain old alcohol intoxication? Is he just drunk? One of the things that argues against many of the toxins, including alcohol that we mentioned, is that he continues to be agitated. Meth is long-lasting. It can last for 24 to even 36 hours. But with toxins like alcohol, hallucinogens, and cocaine, he might not be better in a few hours, but he should be improving and not still wildly agitated because none of those last for that long. Confirming this, his serum alcohol comes back at 0. His urine drug screen comes back positive for cannabis, but negative for everything else. Could this be psychosis from chronic cannabis use? It's definitely something to consider. There's no test for that, so if we rule out other medical causes, we could discuss the possibility further with psychiatry. Wait a minute, did I hear you say? We were just at an absinthe bar. Could this be absinthe toxicity? Time to pick your poison, and that's question number 4. This is most likely due to absinthe. A, true. B, false. All right, before we answer this question, let's talk about what absinthe is, what it's famous for, and the historical figures it's associated with. Absinthe is a licorice-flavored drink. It's made from wormwood. Essentially, it's dried wormwood in ethanol, i.e. alcohol, along with anise and fennel. What's wormwood? It's a plant. The Latin name is Artemisia absinthium. It gets its name, as with so many things, from Greek. It's named after the goddess of childbirth, Artemis, because it was often used for gynecological complaints. The active ingredient in the wormwood is a compound called thujone. Thujone is a GABA receptor antagonist, reducing the effect of GABA in the brain, meaning it works the opposite of alcohol, which increases GABA and increases sedation. Absinthe was created in Switzerland in the late 1700s by a physician. As I'm sure you know, it became extremely popular in Paris in the late 1800s and early 1900s. In fact, in Paris, happy hour became known as the green hour, with absinthe itself being called the green fairy. There's a whole mythology surrounding it, due in large part to the famous people who drank it and some of the medical issues they displayed. Ernest Hemingway famously drank it. Oscar Wilde said, quote, "What difference is there between a glass of absinthe and a sunset?" End quote. Toulouse-Lautrec carried a hollowed-out cane reportedly containing absinthe inside. But absinthe's most famous association is with Vincent van Gogh. Did absinthism cause him to cut off his ear? Well, the whole story is actually incredibly interesting. Many of the details we know were reported by Gauguin. In 1888, Van Gogh had left Paris and removed himself to Arles, France, a more rural area, and convinced Gauguin to come there to start an artist colony. Van Gogh's work from this period is amazing, and it's where he created many of his most famous work, like the sunflowers. His behavior, though, became increasingly erratic. A few days before Christmas, Van Gogh drank a glass of absinthe and then flung it at Gauguin. The next day, he apologized, but then later in the day, rushed towards Gauguin with a razor in hand. Van Gogh turned off at the last minute before injuring him and went home. According to Gauguin's subsequent reports, he regrets not chasing after Van Gogh to take away the razor, because that night is when Van Gogh used the razor to cut off his ear. Afterwards, Van Gogh ran to a nearby brothel and gave the ear to the madam, telling her to keep it in a safe place. She alerted the authorities, and shortly thereafter, Van Gogh was admitted to a psychiatric facility. Writing poignantly to Gauguin in a letter, he said, "Aren't we all mad?" The cause of Van Gogh's mental illness is debated to this day. His physician diagnosed him with epilepsy, a word that was widely applied and doesn't mean the same as we would use it today. It's noted that he was never reported to have a generalized tonic-clonic seizure, but rather partial seizures or fainting episodes. Epilepsy can cause psychosis, but others have suggested it was bipolar disease or medical causes like porphyria. Some suggest that exposure to substances Van Gogh used in painting, like turpentine or camphor, could be the source of his psychosis. Interestingly, his physician treated him with bromide salts, which we've talked about before in the episode Bad Advice. Bromide was used in psychiatry as a sedative in those days, and reporting to his brother, Van Gogh said, quote, "The unbearable hallucinations have ceased and are now reduced to simple nightmares in consequence of taking potassium or bromide, I think," end quote. Unfortunately, his symptoms became more severe, and in July of 1890, Vincent van Gogh shot himself in the chest and died at the age of 37. It's very much unclear, but I think everyone agrees that whatever underlying disease he had was exacerbated by the copious amounts of alcohol that he drank. At the time, many people believed the absinthe itself was to blame. Absinthism is a historical description characterized by hallucinations, seizures, sleeplessness, tremors, and even paralysis. Obviously, given the name, it was attributed at the time to excessive consumption of absinthe. Doctors wanted to determine whether it was the absinthe itself or just alcohol causing many of these issues. A French physician gave a dog oil of wormwood, noting that the dog had seizures. These findings were repeated in other animals. There were sensational news reports attributed to absinthe use. A Swiss man found lying on top of the dead body of his daughter in his yard did not recall killing his pregnant wife and 2 daughters the day before. The police investigation showed he had drunk 2 glasses of absinthe, and the murders became known as the absinthe murder, even though he had also had wine, creme de menthe, and brandy. Because of these issues, absinthe was first banned in the Republic of Congo in 1898, followed by Belgium in 1905. Concern that absinthe was responsible for the mass desertion of French troops in World War I led to its ban in 1915 in France. I guess it was easier for the French government to believe that the desertion was caused by alcohol rather than death, destruction, and trench warfare. A not insignificant contributory factor to the ban actually was the French wine industry. The wine industry was suffering a dramatic setback from the phylloxera infestation. This was a fungus on the vines causing wine prices to increase, and it made absinthe a cheaper alternative and increased its popularity. So the wine industry actually contributed to concerns about the dangers of absinthism to reduce its popularity. What do you think now about absinthe as the cause of our patient's psychosis? Well, you might be aware that there was a reversal of the absinthe bans, and it's now available in the US and Western Europe. Why is that? Because the symptoms attributed to absinthism have not subsequently been proven to be caused by wormwood. They were most likely due to a combination of mental illness, other medical problems, and alcohol, because modern research just doesn't support absinthe as the cause of mental illness in the famous artists in the 1900s or in modern times. Why not? Because the concentrations are too low to cause toxicity, even with chronic exposure. You're going to have significant alcohol poisoning way before you're able to get thujone poisoning, because the concentration in absinthe is very low compared to the concentration of alcohol. The laws were reversed when it was shown that there was no evidence to support absinthe causing significant toxicity. As I said earlier, thujone inhibits GABA. This means it causes overstimulation in the brain and can, in high concentrations, cause seizures. But as I also said before, this is in direct contrast to the action of alcohol, making me wonder if you drink thujone and alcohol if there are any effects at all, or if the higher concentration of alcohol cancels it out. Does absinthe cause seizures? It doesn't, because the concentrations are too low, and as I said, anybody who drinks massive quantities will develop severe complications of alcohol toxicity way before they drink enough to develop wormwood or thujone toxicity. That said, thujone itself can be toxic in large concentrations. Let me tell you about a few interesting case reports. In 1997, a 31-year-old man was found confused and disoriented. He had a seizure. This patient had drank 10 milliliters of oil of wormwood, assuming it was absinthe. This is a very highly concentrated amount of thujone. His main issue after this was rhabdomyolysis, i.e. muscle breakdown. In another case in Switzerland, a man was admitted to the hospital with mania after ingesting a liter of an infusion of Artemisia vulgaris. So yes, a high concentration of thujone can cause an altered mental status, seizures, and rhabdo, but not the extensive medical and psychiatric issues reported in the past and attributed to absinthe. The issue of concentration is a very interesting one. Initially in the late 1990s and 2000s, when some of the absinthe bans were lifted, there were limitations on thujone concentrations, and this was due to a mistaken belief that in the past, absinthe had contained extremely high quantities of thujone. Initial estimates, I'm not sure from where, suggested that absinthe in the 1800s had 260 milligrams per liter of thujone, but modern testing of samples from that time showed it was much lower, around 25 milligrams per liter. There was another interesting speculation that copper toxicity might be responsible for absinthism, given that absinthe is not naturally green and that coloring agents were often added. This was also disproven with analysis of bottles from the 1800s showing copper levels lower than amounts permissible in drinking water. Wormwood, the plant, has been used extensively as a medicine since ancient Egyptian times. In the Middle Ages, it was used to get rid of tapeworms, thus the name wormwood, I suppose. Question number 5. A compound derived from Artemisia plants was found to treat which of the following diseases? And in fact, its discoverers were awarded the Nobel Prize in Medicine in 2015. Is the disease A. Cholera, B. Syphilis, C. Tuberculosis, or D. Malaria? The answer is D. Malaria. A different compound found in Artemisia species called artemisinine is used in medicine to treat malaria. Interestingly, in the 1840s, absinthe was given to French troops in Algeria to prevent malaria, though this wouldn't have worked because it did not contain artemisinine, and even if it did, it would not have been long-lasting enough to stay in the body to fight off the malaria. So, back to our patient and to finally answer question number 4. B. False. Absinthe is definitely not the cause of his psychosis. After an extensive workup, including a spinal tap, no medical cause is identified. After an extensive psychiatry evaluation, they conclude that he has bipolar disease with psychosis likely exacerbated by chronic alcohol and cannabis use. He started on antipsychotics with marked improvement in his mental status. He's advised to stop drinking alcohol and cannabis, and you're aware that he has a long and difficult road ahead of him. There are many references to wormwood throughout history. It's mentioned several times in Shakespeare. In Romeo and Juliet, the nurse says that she weaned Juliet by applying the bitter taste of wormwood to her breast. In Hamlet, a character expresses distaste for remarriage, and Hamlet responds, quote, "That's wormwood," meaning it's the bitter truth, referring to his mother's remarriage. The last question in today's podcast. What city is named for wormwood in its native language? Is it A. Chernobyl, B. Damascus, C. Istanbul, or D. Tbilisi? Follow the Twitter and Instagram feeds, both at PickPoison1 for the answer. Remember, never try anything on this podcast at home or anywhere else. Thanks for listening. It helps if you subscribe, leave reviews, and/or tell your friends. Transcripts are available at pickpoison.com. While I'm a real doctor, this podcast is fictional, meant for entertainment and educational purposes, not medical advice. If you have a medical problem, please see your primary care practitioner. Until next time, take care and stay safe.